All right, our presentation today is going to be about saving lives. It all sounds exciting, but when, we have the opportunity and when we're faced with the opportunity to save a life, what is the first thing that we do? We panic, don't we? If we know the steps that we have to take to save someone's life, it makes things so much more interesting, so much more, it makes it so easy for us to be able to practice these techniques. But what I want to teach today are some basic skills at assessing the patient, someone who's fallen. If you're walking down the street, walking down the street and you see someone who's fallen, what's the first thing that you would want to do? Panic, apart from panic. Before you call 999, maybe they're drunk. You see people on the street all the time, don't you? They might be drunk. What would you want to do? Someone's fallen in the street. Before you try to save them, you check for safety. You're not sure why they've fallen. You're not sure if there are trucks in the road. You're not sure if they've been shot. You're not sure if it's a dark alleyway. Maybe they've been stabbed. You check the area for safety. So the first S is safety, children and adults. Don't just dive in trying to save someone's life. Check to make sure the area is safe. You're looking to see maybe the person's been mugged, maybe someone's around who's hurt them, maybe the person slipped on the floor. So check the area for safety. So we've checked, area is safe. What's the next thing that we have to do, Kenya? What do you think we need to do? Someone's fallen on the floor. The next thing we do, we check and see, maybe they're just sleeping. Stimulate them, shake and shout, hello, hello, Mr. Brown. Mr. Brown, there's no response. Mr. Brown isn't saying anything. What shall we do then? We're by ourselves. What do we do? Before you call 999, shout for help. Shout and, check to see if anyone's around. Help, help. So the first S is safety. We're checking to see if the area is safe. Check for safety. The next S is shake and shout. You stimulate them. Check and see if they're just sleeping. Check and see if they're responding to you. Hello? Hello? Kenya, if you go on that side. And then I've shouted, Kenya, come and help me. Come, I don't want to deal with this by myself. So you shout for help. So the three S's, safety, then stimulate. Hello, Mr. Brown. Hello. No response. Then we shout for help. You shouted, maybe a shopkeeper's around. Maybe someone's riding on the street on a bicycle. You stop someone because you don't want to deal with the situation on your own. You don't want to be by yourself. So three S's. I'm always going to go through this. Check for safety, stimulate, then you shout for help. And once you've shouted for help, you're going to start looking at the patient, looking at the person on the street. They're fallen. The first thing we want to do is check the airway. So A is airway. And where's the airway? Where do people breathe from? The nose or the mouth. So we're checking. Have a look in. What kind of things would you see in someone's mouth? What kind of things are you looking to see? Blood, very good. A lot of times if someone's been hit down or if someone is in cardiac arrest, if they've had a heart attack, there's lots of blood in their mouth. So check and see if there's any blood. What else would be in there?
Something stuck in their throat.
Yeah, maybe they've choked on something. Check and see if they're choking on something. Just have a look in the mouth. So that's the first thing you're looking. You're looking at the mouth. Checking to see if there's any blood, vomit, saliva, if they're choking on something. If there's lots of blood and vomit, what would you want to do? You try and move them to the side and let it just, let it roll down by gravity. So then move the head to the side. If there's blood, vomit, saliva in there, get it out. What's the next thing that we want to do? We want to open the airway. And we use this technique. It's called head lift, chin lift. All the way back. All right, so we're going to open the airway. So we check the airway, we've made sure it's clear, then we're going to open the airway. And then we're going to check the breathing. So A for airway, and then we're going to do a B check for breathing. And how do we check the breathing? We're looking at the chest, rising and falling. We're listening to see if we hear any breath sounds, and we're feeling any breath sounds on our cheek. Okay? So let me show you the technique. Head tilt, chin lift, open the airway, and we're getting really close. We're looking at the chest, rising and falling. We're listening. Can you give me some nice deep breaths? To see if we hear any breaths. And we're feeling the breath sounds on her cheek. But this person, we're not feeling anything at all. They're not breathing. I can't hear anything. I can't feel anything on my cheek. And they're, I can't see the chest rising and falling. What's this? The person is dead. They're in cardiac arrest. So if there's no breathing and there's no signs of life, they look dead. They're looking blue. They're not moving. They're feeling a little bit cold. There's a good chance that the heart has stopped beating. Okay? Instead of panicking, I'm going to show you what you do. So let's go back again. Kenya, you're walking on the street. Mr. Brown's on the floor. What's the first thing that you want to do? Safety before you run in. Everything's safe. Tell me what the next thing we do, Vanessa. Before you shout. Because you know what? He might just be sleeping. He might just be sleeping. Sometimes people just sleep on the floor. So you shake and shout. All right? Hello? Hello? Mr. Brown? He's not responding. What do we do next? Before you do that, shout. You shout, help, help. The shopkeeper comes running. People come around. So you have help. And then we're going to do, what we're going to check? Airway. What we're looking for in the airway? Blood, yeah, blood, vomit, so anything in the airway that could cause any problems. Everything looks safe. We're going to open the airway. And then what we're going to check for? Breathing, because after airway comes the B check. That's breathing. And we're checking for 10 seconds. All right, so everyone count with me. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. You know what we're looking for at this time? We're looking for the chest rising and falling. You can see his chest rising and falling. No, I can't see that. We're listening for breath sounds. And it's really hard. If someone's collapsed on the floor, they're not breathing very well. So you have to tell everybody around to be quiet. It's really hard to hear. So you say, be quiet, everyone. I'm listening for his breathing. So 10 seconds to listen for the breathing and looking and feeling. He's not breathing. There's no signs of life. I think he's dead. What are we going to do next? Apart from panic, we're not. He's not breathing. What's the first thing that we have to do now? Before you resuscitate, what? Call. And who we're calling? We're calling Pizza Hut? Who we're going to call? We're going to call. Who are you going to call? Ghostbusters? No, we're going to call 999. Yeah, why are we calling 999? Are we going to call for the fire department? Ambulance. Okay, they're going to say, has anyone ever made a 999 call? Have you? What's the first thing they ask you? Yeah, they ask you, what's the emergency? And, when we, as much as we love firemen, we really want the ambulance this time. So the ambulance, we want the ambulance to come because the ambulance, these are the people who come and they save lives. They put on they give the person lots of medicine. They get the heart beating again. Do you remember that footballer last year? Remind me his name. Yeah, you know what my thing is, if you're going to have a heart attack, have it in a football stadium, isn't it? Because he had everything. He had the best surgeons, he had the ambulance, everyone came down and, they did all the right things. What was he doing? Was he kicking? Was he just running? When did he collapse? In the middle of the ride. So what did they do? He collapsed on the football field. What's the first thing that they would have done? No, when they saw him collapse on the floor, what's the first thing that they did? To check for safety, but it was safe because, it was a football field, so they had all the police, so it was safe. And what's the next thing that they would have done? Pardon? Before they stimulate, yeah, they would have stimulated, they would have said, what's his name? Fabrice. He didn't answer. What's the next thing that they did? They shouted for help, but the whole stadium was saying, Fabrice. So they had loads of help, so they didn't have to call for help. And then, they had lots of doctors there, and the doctors checked the airway, and they checked to see if there was lots of blood, and then they sorted it out because they probably had suction there. And then what did they do? They opened the airway, because if you're checking for breathing, the airway has to be open. All right, that's important. If your mom collapses at home, if something happens and you want to check to see if she's breathing, you can't just leave her like that. You have to open the airway. You have to put the head back. Because what happens if someone collapses? the tongue falls back and it blocks the airway. And that's what makes them not breathe. So if you get one thing out of this, is that you open the airway. Someone collapses, what happens is that the tongue falls back, it blocks the airway, and they can't breathe. And a lot of times, what was that? You know, I'm not from England, but there's a football, what was that match when lots of people died? Was it in Wales? And they brought all these people on the field and they just laid them on their back. And when they went back to check them, a lot of them had died because they didn't open the airway. So what you have to do, if someone's collapsed, the important thing is that you open the airway, get the tongue out. And I'm going to show you recovery position. I'll get someone to demonstrate. But make sure the airway is open and then do your breathing check. So open the airway and then how long are we checking for the breathing? 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. We're checking to see, tell me the 3 things we're looking for when we're checking for breathing. Chest, up and down, feeling of the breath. Nice warm breath. What's the other thing? Looking, listening, and feeling. But if someone's collapsed, they're not going to be breathing very strong, so you have to get down really close, make sure it's really quiet. So looking, listening, and feeling. For 10 seconds. This person is not breathing. There's no signs of life. They're not coughing, they're not moving, they look dead. What happens when the heart stops beating? The person is physically dead. There's no blood circulating around the body, because if you guys, with biology, the heart is that pump that pumps the blood around the body, and in the blood is oxygen, and that's what the body needs, and all the organs need oxygen to survive. So if the heart isn't pumping, the person is basically dead. So, the football player, he was dead, and they had to resuscitate him. They had to bring him back to life. But what happens if we make the call, if we say, okay, this person is dead, all right then, let's have a cup of tea, we'll call the ambulance. That's not what we're going to do. We have to be providing basic life support. And what that means is that while we're waiting, so we've called the ambulance, while we wait for the ambulance to come, and the ambulance, the paramedics are really good. They'll come, they'll put defibs on, the thing that they shock the person with. Have you watched ER and you see them shocking the person? That's what restarts the heart. They'll give them lots of medication. They'll put a tube down their throat to help them breathe. But if we just sit around having a cup of tea, watching TV while we wait for the ambulance, what's happening is that the heart isn't moving that blood around the body, and there's no oxygen going to all the tissues, especially to the brain. And the brain can't do without oxygen for at least 2 minutes. If the brain doesn't have oxygen in that time, the brain dies. So what happens is that if we call the ambulance and we know they're coming and we're having our cup of tea and the patient is just there, the guy's just sitting down there, and the ambulance comes and they put on the pads and they shock him and they give him all the medicine and they start breathing for him, and everyone is like, yay, the heart is beating again, and everyone's happy. But they check to see that the brain is dead. So the person, even though they have a beating heart, the brain isn't functioning. So that person is pretty much a vegetable. They can't function. They have a beating heart. So we haven't done our bit. So that's what I'm trying to teach you, to make sure that once you call the ambulance, you can start physically pushing on the heart to push that blood around the body to get the oxygen to the brain. And that's what we're going to practice today. I'm going to get everyone to give me some compressions. All right, so you've made the call. We've called 999 and we're waiting for the ambulance to come. The first thing that we want to do is start giving compressions. And you've seen the ads on the TV. A lot of times people, if there are incidents like this that happen, people think, oh gosh, I'm not going to touch them mouth to mouth. I just don't want to catch AIDS, or I don't want to catch, what. You don't have to start snugging them. You don't have to start kissing them. All you have to do is give compressions if that's what you want to do. And that really helps. They have ads on the TV and it says, if you just start pushing on the heart, that will help. So we're going to give compressions. Look at the chest, middle of the chest. Just find a location, middle of the chest. And we're keeping our arms straight, keeping your fingers off the chest. And it's 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30 compressions. And if you're able to, or if you want to, give 2 breaths. The breasts are important, but the compressions are even more important. So if it's a family member, and if you really like your husband, you probably would want to give it, isn't it? But you know, the breasts are important. But if you're on the street and you don't feel like you want to give the breast, you don't have to. You just keep giving your compressions. So I'm going to get people to practice in a minute. But the breasts are important also. So you have to open the airway. Remember I said, if you just start, it's not going to work. You have to open the airway, pinch the nose, and give your 2 breaths. Okay? So it's 2 breaths, and you blow in. Can you see the chest rising and falling? That's what you want to see. So pinching the nose. But if I just went like, if I pinch the nose, I would need resuscitation because you're not going to be able to get the breath in. All right. So you need to open the airway and then give your breath. All right. So like I said, you really have to care for that person or like that person to be given mouth to mouth. If not, don't do it. Just give your compressions, okay? So 30 compressions and 2 breaths. So you just keep going. 30 compressions, 29, 30. Pinch the nose, open the airway. 2 breaths, and you keep going. 32, 32. And hopefully the ambulance will be there in a few minutes. And they will take over. So that's it, that's basic life support. What you're doing is pushing on the heart, pushing that blood around the body to keep oxygen to all the tissues, all the organs, especially the brain. Because you don't want the ambulance to come and get the heart pumping again and the person is brain dead. And you have about 2 minutes. So you don't have a long time. So you have to know what you're doing. You have to remember. All right? So I want everyone to chip in on this now. You're running down the road and someone's collapsed on the floor. What's the first thing that you do? Safety. Safety. You're looking for cars, you're looking for bicycles, you're looking for water, anything that could cause problems because you don't want to go in and be in the same situation. What's the next thing that we do? Everything's safe. Shake, stimulate, shake and shout. Hello, hello. No response. What's the next thing that we do? Shout for help. Hi, Mr. Brown, Mr. Brown. And people come to help you. What's the third thing that we do? You start with your A. Airway. Check the airway. Make sure nothing's in there. If something's in there, just move it over. There's lots of blood. Move it over. Airway safe. What's the next thing that we do? Breathing. You have to open the airway. Open the airway and do a quick breathing check. And what we're doing when we do the breathing check? Looking, listening and feeling. Looking for the heart, chest rising and falling. Listening for breath sounds and feeling. So you get down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. There's no breathing, no signs of life. What's the next thing that we have to do? Call who? The ambulance. What number do we dial? 999. Call the ambulance immediately. Don't start unless you've made that call because you're going to be doing compressions until whenever. Make sure someone's made the call. And the person who goes to make the call, you come back and say, I've called the ambulance, they're on the way. All right. The things that the ambulance would want to know is your postcode, things like that. Where exactly are you? They're going to ask for, and you tell them, I think this person, is having a heart attack and cardiac, the words like that you say. Because if they think the person is just drunk or they don't think it's a serious emergency, they're not going to give you priority. But if you say cardiac arrest, they put you at the top of the queue and they're going to come immediately. And a lot of times they'll come with, they'll send someone on a bike and then they'll send the ambulance. They'll send the rapid response first and then they'll send the ambulance. All right, so you've called for help. What's the next thing we do? Start doing your compression. Start beating on the heart, okay? Pushing the blood around. And middle of the chest. 1, 2, 3, 4, 5, 6, 7, 8. I get people to come and practice for me. Come on, come to some compressions. Keep your arms straight. And it's 30 compressions, 2 breaths. Don't do the breaths because it's all on my lipstick. But when you go home, you can practice on each other.
How hard should I do?
Yeah, hard until you hear that sound. That sound on the dummy means that she's going, deep enough. But in a real person, if you're doing that and you hear sounds, don't keep going. That means you're breaking the ribs, okay? All right?
It's quite hard.
It is quite hard. You really have to go for it. So you keep going. The arms are straight. Yeah, 1 and 2 and 3 and 4. Next person, come on.
I'll have a try.
Well done. Shay's going to try. You going to save your mommy, Shay? Yeah? All right. No, you turn to the side. Turn to the side. Yeah, because the person has legs, Shay. Remember. No, you're on the belly. Come up a little bit. Yeah. Keep your arms straight. Keep your arms straight. Yeah. Go on, Shay.
Yeah.
That's it. That's it. Yeah. Shay, so if I come over for dinner, you're going to save me? Yeah. All right, Shay, give Kenny a turn. Oh, it's hard, isn't it? It's not easy. I mean, kids, if there's an adult around, you're going to get the adult to do it. But if you're by yourself, please try. All right, go on. No, you have to put your, yeah. That's it. Push hard. Push hard. That's it. Push hard. 1 and 2 and 3 and 4 and 5 and 6. Who else is going to come and give it a go? Everyone come. Everyone have a little practice. Find the middle of the chest. Good girl.
I don't know how to do
Yeah? You know how to do it? Yeah? So just middle of the chest. Yeah? And then just push it hard. Yeah. That's it. That's it. That's it. Yeah? That's it. Well done. That's it. That's perfect. Keep your arms straight. And it's a, yeah. Yeah, don't lose contact, yeah. Yeah. So it's a rocking motion. Yeah. But it needs to be really good compressions. So maybe get the strongest person to go, but the compressions have to be, that's really good. That's right. Who else wants to try? Yeah, that's all right. So 30 compressions and then 2 breaths. Yeah, that's it, just right there. Yeah, that's perfect. Keep your arms straight. Yeah, that's it. And it's a rocking. Yeah, that's perfect. Yeah. All right, so it's 30 compressions, 2 breaths, and you keep going until the ambulance gets there. Any questions at all about that?
When you say if they have something in the mouth, you said tilt the face.
Yeah, just move the head to the side. Well, however you can get, if you can. You just move to the head to the side and try and get it out. You know, by gravity, just move it to the side and let it drain. You know, you can try and scoop. You know, a lot of times with people with cardiac arrest, they vomit. Lots of vomit, so you're trying to get that out. Vomit, blood, saliva, lots of things. If there are dentures in there, loose dentures, if they're very loose, try and pull them out. You know, if you see a big chicken bone in there, take it out. You know, anything that's going to block the airway.
Just put the head back. Wouldn't that make the throat and the tongue stick back?
No, pulling the airway back pulls the tongue. Just that motion pulls the tongue out, yeah. Yeah, it does. It opens the airway, pulls the tongue away. Yeah.
Clear everything.
No, you try as much as you can.
Otherwise, it will, when you open up, it will stop.
Exactly. So that's why it's important that you check it first and try and clear. Because if you open and there's lots of vomit, it's going to go all the way down into the lungs and cause problems. Yeah.
But if you open it,
Pardon?
if you open it, like you say,
No, that's why I would say it's important to clear it first.
clear it first.
Yeah,
So
clear it
you
first.
don't do that.
Yeah, you just scoop it, move it to the side and just clear it. The motion that carries it back is moving it back. You don't do that. You just try and move it to the side and try and clear. Yeah, I'm a dentist and in practice, I mean, we have, people vomiting all the time and we would use suction. But you guys wouldn't have suction, so just move the head to the side and just clear the vomit. Yeah. Any questions at all? No? I'm quickly going to talk about stroke because stroke is, it's really it's quite common now. Lots of people are having stroke and, in the olden days, it used to be old people that would have strokes. Now, younger and younger people are having strokes. And it's really important. I mean, it's something really dear to my heart because my friend, who's the same age as I am, went to Jamaica on holiday and she had a stroke. Didn't even realize. All day she was walking. She went to the post office trying to sign a letter. She couldn't lift her arm up. She was walking. She noticed that her leg just wasn't, she wasn't as mobile as she usually is. She trying to get her leg up into the cab and she's thinking she's having to lift her leg into the cab. And then towards the end of the day, she couldn't move. They carried her to the hospital and they realized she had a stroke. And she'd had this stroke at the beginning of the day and all through the day. She had these symptoms and no one recognizes. So recognition of stroke is so, so important. They talk about this on TV all the time. What's the test called that we use if you think someone is having a stroke?
Time, Dad.
Yeah, time. Yeah, but T is the last thing. It's called a fast test. And it's really important, but so simple, but it can make such a difference. Stroke is one of the highest causes, well, it's the highest cause of adult disability in this country. It means that most people, you know, a large majority of people, of older people in wheelchairs or who can't walk is as a result of stroke. So that's important. It's the third largest cause of death in this country, behind cancer and heart problems. You know, so that's quite significant. And it's simple. Recognition is the key. It's a fast test. What does the F stand for?
Face.
Face. And what are we looking on the face? We're looking for one side is dropped, or they can't smile. You know, you're thinking there's something not right. What's the A for? No, what's the A for? A is for arms. Ask them to hold their arms up. And if they can't hold their arms up on their own, you know, and the arms keep falling down, then there's a problem. The S is for speech. The speech is slurred. They can't complete a sentence. You know, they're slurring the speech and not pronouncing the words properly. Then that's a problem. And T, like you said, was time. Call the ambulance quickly. The quicker the quicker it's diagnosed, the quicker it's treated, the better the results are. Because my friend, she's the same age as I am, probably a few years older, because it took so long to diagnose the problem, she had, you know, she can't walk properly. She can't lift her arm. You know, and if it had been noticed earlier, then, you know, the results would have been much, you know, better. You know, things would have been so much nicer for her. But because it took so long. So if you think that, you know, someone's, you know, that you look on them and their face just looks weird, you know, the side of the face is dropped, and they just look, oh, you know, they just don't look normal. Do you ask them, hold your arms up for me? And if they can't hold their arms up, you say to them, you know, can you say, you know, listen to them speak, and then you hear them slurring, they're having a stroke, call the ambulance immediately. There's something wrong, there's something not right. You know, sometimes we think people are just being lazy, or, you know, start thinking, start listening out for these things. You know, always at the back of your mind, start thinking it might be a stroke, okay? So very important. Think about the fast test, you know, and, you know, the things we spoke about with the basic life support, with the assessing, you know, checking airway, the breathing, calling the ambulance is really important. All these things are important in saving lives. You know, there's so many other medical emergencies that we could go through, but you know, time is on us. But I hope you got at least one thing from this presentation. You know, I hope you learned a little bit. If something should happen at home, you always call the ambulance, 999, but you can do a little bit of assessment, you can check, and you can, you know, start opening airways, you know, if needs be. All right? Any questions at all?
You know when your friend, how she had the stroke, how did she call the ambulance?
She didn't call the ambulance. They carried her. They realized when she couldn't walk, they realized that something was really wrong. And she was in Jamaica, so they didn't even have an ambulance. They had to put her in a car and just drive her to the hospital. There's no ambulance. There was no ambulance where she was. No. They had to put her in the car and drive her to the hospital. So that took even longer. Yeah. All right. Everyone found that useful? Yeah? All right. Thank you.